try to indeed very quickly rush through and add on what's everything's been said with my remark on narratives. And when I'm talking about narratives, of course, I want to focus especially on discourse and messages that we've heard, well, perhaps mainly from official quarters, from leaders, and how much that's been reflected perhaps in the media discourse too. Now, of course, it's a frequent observation that predates the crises and the pandemic that American and European views have been divergent, and on this pandemic, we've had no difference as well too. Very strong, I think, marked preoccupations. Added to the fact that, of course, the timelines of the pandemic haven't been exactly in sync in Europe and in the United States in terms of the spread of the pandemic as well too. So that's commanded some different attitudes and messages at times too. And finally, of course, a particularity that's been highlighted in other talks is the fact that the US is in this election year. And that's, I think, given a particular political force to the kind of narratives hearing from the US. So what I'd very briefly like to focus on is perhaps to show you one example of a major theme that's come out of the US narrative on this crisis. That contrasts in the second point to what's been the major theme that I'd see coming out from the European narratives. And finally, point out a few areas of points of convergence, but that doesn't really is going to help entirely the two views to be reconciled. So what I'd say first about the major theme that emerges in the US narrative, and in part from the declarations of Donald Trump, because we've seen him take the really unprecedented and unimitated tactic among his European counterparts of giving these daily press briefings that have had the both an electoral function and of course we're also meant to give out some sort of public information about the state of the crisis. But what has been quite consistent in this US narrative is this emphasis on the fact that we're here in the presence of a foreign-originating crisis, and that tends to link up with preoccupations that have been expressed by Donald Trump and his supporters over the years, that most of the problems come from abroad and are not homegrown. Obviously, you've all heard about the expressions of his emphasis on the Chinese virus, on the foreign virus, and now something we hear more often is the invisible enemy. But there's a lot of double entendre behind that too as well. Obviously, as I was saying, the narrative was impacted by the fact that the crisis, the pandemic took a little longer to reach in massive elements the US territory than Europe. There was this decision quite early on by the US administration to cut air links to China. At the time, this was seen as then generating a problem because you needed to organize repatriation flights for people who were out. The Europeans kind of followed suit on that as well. There was another, of course, well-known case, which was the passengers of the Diamond Princess who were in quarantine in Japan as well, that also underlined the foreign dimension of the problem at first. And then later on, as the disease spread in Europe, there was the decision that was taken without consultation, and that really upset a lot of Europeans to sever the air links with Europe as well. And that created another big logistical repatriation headache on both sides of the Atlantic. So what we get out of this, the tendencies that come out of this narrative of the crisis being a foreign originating crisis, there's been this tendency that lasted quite long in Donald Trump's declaration to minimize the gravity of the virus and of the disease. There's also, of course, an element that's now gone over to the domestic scene of shifting blame to others from Washington to abroad, but also now to local authorities in the US on how to handle adequately the crisis. There's been consistent claims that the sanitary response in the US was supposedly more efficient there than in other cases, and that's been dispelled quite early because of the problems detected with the testing systems that the CDC had first put out as well too. And now, of course, one important theme that's emerging in this narrative are the arguments about when and how fast to end up the lockdown. And you're seeing the economic priorities and the fear of an impact on the election becoming very present in this whole discourse. And the latest move to cancel the attribution of all green cards, even to legal immigration, kind of reflects this preoccupation. At the opposite point of view, the major theme I'd see among the Europeans, and that's also something that predates the crisis as well, is this preoccupation with the breakdown of the multilateral way of doing business. And as has been stressed by other speakers, the origin of that is attributed mainly to US policy as well too. Now, of course, it also masks the fact, and I think René mentioned that as well too, that originally, even amongst the Europeans, there wasn't a very good coordinated response to it at first, especially with the early bans on supplying of medical equipment to the worst hit states. I mean, it's slightly improved since, with especially with the schemes of patient sharing. They've done, I think, a lot to repair relations as well too. I've already alluded to the fact that yes, there was a European annoyance expressed when the U.S. shut off its air links and travel links to Europe, and that's not over yet. There've also been, of course, a particular aspect which was expressed by some European political leaders as the crisis unfolded, about a fear about unfair competition by the US for access to medical supplies. This is one aspect which we saw the affair of that was highlighted in Germany by this attempt by the US to buy into this pharmaceutical firm that was developing a vaccine and that wanted an exclusivity of trial and use, and that didn't help the climate as well. It was also expressed, I think in particular, some French politicians, local politicians who are trying to supply masks to their own constituents, who were ordering them en masse in China, and then started declaring when the masks weren't delivered that they had been outbid all of a sudden by some unknown, U.S. competitors who had shown up in China and basically bought all the masks instead of the Europeans. And the ironic aspect of this was that it seemed to want to shift the blame to these U.S. interlopers rather than to the Chinese sellers for going over their contracts as well too. So you had a lot of blame shifting there too as well. And we've also noted, of course, the negative European reaction to the decision to suspend U.S. contributions to the WHO. Now, perhaps one last theme that might emerge quite dominantly in the European narrative on this point is that now we're going to see this enormous disease cluster in the US, and Loren's been very eloquent about the fallout of that, and that's going to have some kind of impact on Europe, no matter how small the ties have been reduced in this pandemic climate. So, of course, how will it be possible to reestablish the normally strong transatlantic interaction in trade, in economics, in finance, in health cooperation, political and military cooperation as well? If there's a US economic collapse, what's going to be the fallout on the European recovery as well too? And I'd like to end up on some areas of convergence, strangely enough. Whereas we saw this early emphasis in the US on, blaming China on this matter, it's interesting to see that, now some of the Europeans are actually nodding along and of course observing that, yes, there has been a bit of a China problem in respect to data sharing, to influence over the WHO. Obviously, in some ways there's a point of convergence between Europeans and Americans on this matter. What we're also seeing in terms of the trends of the messages as well too is that the Europeans are going to experience, just like the Americans, the same kind of fraught debate on sanitary versus economic concerns and what should be prioritized now. The Europeans themselves have not been immune either to what we've seen in the US discourse on the emergence of conspiracy theories all around the origins of the pandemic and how to treat it as well too. There's of course, for instance, something we've seen on both sides of the Atlantic is the politicization of the promotion of particular cures or treatments that are supposed to be more efficient than others, and which political opponents to the governments in place have been highlighting to say, well, if I were in charge, I would do this differently, but not necessarily backed up with the medical appropriateness of these statements as well too. And there is this issue that will be similar in Europe and in the US about how to exactly coordinate reopening efforts, which are going to vary according to the sanitary and economic situation in various places. So that will be, of course, a difficulty on the cohesion inside the United States and also inside Europe as well too. I mean, no small challenge for whoever's in leadership in the next few months. So I'd finally like to conclude that one of the big questions that is really going to be similar on perhaps both sides of the Atlantic is that will there be any efforts to coordinate an economic response, and that will be all the more difficult when multilateralism is in a sad state on both sides of the Atlantic. So to sum up, I'd add that the crisis has really exacerbated differences of opinion amongst American and European leaders. We've already had a damaged working culture between them that's going to require additional efforts to fix as well. And there's this climate of increased suspicion that we see overall.